Good afternoon, Robert.
How are you, LaShawn?
I'm good. How are you?
I'm doing good. I have a dentist appointment at 3, so at 2:30 I've got to go get in my car, but I can take the meeting with me on my phone.
Okay, perfect. Well, just so you are aware, I am recording the meeting.
Okay.
We will begin here shortly.
Okay.
Good afternoon, everyone. We will begin here shortly. Good afternoon, everyone. We're going to give it a few more minutes before we begin.
Good afternoon. I was just checking. LaShawn, do we have a quorum yet?
We do have a quorum. Would you like me to go ahead and start the meeting?
I think so, unless others, Margaret and Suzanne, does that make sense to you? Okay.
So, yeah.
Okay.
Perfect. Good afternoon. On behalf of the Division of Healthcare Financing and Policy, I would like to call the meeting to order and verify that this meeting is being recorded. Today's meeting agenda for the Medicaid Reinvestment Advisory Committee was posted on December 5th, 2022 on dhcfp.nv.gov and at notice.nv.gov. I will go ahead and move to agenda item 2, roll call. Suzanne Bierman.
Here.
Timothy Birch.
Present.
Seraphine Calvo Areola. Frank Deal.
Present.
Haley Gerolimic.
Present.
Margaret LeBlanc.
Present.
Fulala Riley. Kathy Thomas. Robert Thompson.
Present.
Erica Washington. Okay, I will now pass the meeting to Chair LeBlanc to get us through the rest of our agenda.
Thanks, LaShawn. Up next is agenda item number 3, public comment. We invite anyone to speak.
Good afternoon. My name is Sarah Adler. I'm with NAMI, Nevada, and I just wanted to thank you all for the work that you do on this committee and express that many of us in Nevada are working hard to make supportive housing more of a reality in our state. And that is going to require communication, commitment, and partnership among many parties, including our MCOs. And so I appreciate your discussion today, and I hope we can have that concept in mind. Thank you.
Are there any others who wish to speak for public comment? Okay, we will move on to the next agenda item, number 4, review and approve the meeting minutes from the previous meeting held on September 29th, 2022. The meeting minutes were sent to the committee members prior to this meeting for review, unless members have any issues they would like to raise at this time. Okay, I'm not hearing anything. Is there any public comment? I'm not hearing anything. I'd like to call for a motion to approve the meeting minutes.
This is Tim. I'll make a motion to approve the minutes as presented.
This is Suzanne. I'll second.
LaShawn, is there any, do you have to call roll?
Would you guys
No.
like me to go ahead and do roll call, Suzanne?
Approved.
Timothy Birch.
Approved.
Frank Deal.
Approved.
Haley Gerolimic. Margaret LeBlanc.
Approve.
Robert Thompson.
Approved.
I think that was it on our roll. Motion passes. Up next on the agenda is agenda item number 5, review items for consideration, to be presented by Suzanne Bierman and Stacy Weeks.
Stacey, do you have a slide deck?
Yeah, there it is.
Okay, perfect. You want me to do the first couple and then I'll hand it over to you?
Yep.
Okay, that sounds great. All right, well, here is a recap of today's agenda. We'll be talking very briefly about the purpose of this committee. A reminder about the requirement for a recommendations report, an overview of the activities. Then we will present a proposed meeting schedule for I guess review the proposed or the schedule for this year. Sorry, I thought I was looking forward to next year, but I think that's just reviewing the times we've met this calendar year. A refresher on the managed care organization contract requirements and the community reinvestment plan requirements specifically. Next slide. Okay, so here we have a quick outline of the duties of this committee, and that is to review reports by the managed care organizations concerning the reinvestment of funds in communities that have been served by the state's managed care organizations. We have done that in our prior meetings, so thank you all for your assistance in accomplishing that duty. The next is to report to the division and the managed care organizations on local government initiatives to address homelessness, housing, and social determinants of health, which is ongoing. And then today, really, we hope to make advisory recommendations to the division regarding the reinvestment of funds by the managed care organizations with respect to developing innovative partnerships with community organizations and housing service providers and supporting local government initiatives already underway to address homelessness, housing issues, and social determinants of health. Next slide, please. Okay, again, just a quick overview of the requirement to make a report to state lawmakers on this committee and the recommendations. It is due by or before December 31st, and that report should include information on proposed use of funds reinvested by the managed care organizations and communities, including efforts to address homelessness, disparities, and social determinants of health, and the activities of the committee during the calendar year, including recommendations made by this committee to managed care organizations about the future reinvestments of funds. The committee's recommendations are, as I mentioned before, advisory in nature and will apply to the community reinvestment plans that will be distributed during contract year 2023, which starts in January. The focus here is on Clark County, but managed care organizations, of course, do also serve Washoe County, and about 80% of the state's members do reside in Clark County. So I think appropriate to have a large focus on Clark County. Next slide, please. Okay, Stacy, is this where I'm supposed to hand it over to you?
Yes.
Great, thanks.
You're welcome. All right, everyone. So this was just a sort of really quick snapshot of some of the presentations that we saw. I think it was the first meeting where the plans walk through their outlined activities. This is the first year in the contract. So this was their proposals early on about what they were planning to spend some of their profits on for this contract year or this contract year. So some of those, as you guys know, were housing supports, were, related stuff around housing would also be financial services for housing, health literacy was another, food supports for members, behavioral health support centers was another one, Project Echo, which I think members should have received a letter from Project Echo as well about some of their efforts, and maternal and infant health promotion, health information exchange. This is really, for those of you who may not be, familiar with HIE, it really is our system where we share data and information about the population. It also allows providers to keep an eye on where folks are in the system and can better manage care. So just a sense there of why that's important. And then also mobile unit for health promotion, and then also community integration for the justice involved population. There were some supports around that. and then health equity training for providers. Those were the big high pieces that the plans had all kind of talked about. Granted, not all of them are doing the same things, but that's a summary of everything in one bucket. Next slide, please. All right, and so the items presented to this committee, this is what we're going to walk through, and it's a lot because I will be honest, I am not an expert in each of these pieces that were presented by in front of us before we make recommendations. Henderson City had a lot of different initiatives that they brought forward. A lot, you know, they have the housing homeless response team. They had a lot of materials about that in their presentation. They also propose a lot of food related activities that they're doing with their residents. And you can see these different activities here listed, and then health and wellness related activities. Some of these had to do with just making the city walkable, right? Bikeability. And then some of them also had to do with opioid crisis. So it's kind of a broad array of activities here that were health and wellness related. Then the last bucket here had to do with more on the education side for children. As we all know, I think, you know, health and education are very connected. So that's why they included it. Henderson Education Initiatives Team. They're working with schools, as well as One Hill Resilience Project, which was really focused on emotional and behavioral health needs of children in schools. And there were others as well, but this is how we sort of grouped them up for you guys to think about them. Next slide. Clark County also brought a handful of initiatives that they have and they would like to see funding for. There's 6 here that I was able to pull out. There might be more, so I apologize if I missed anything. Please, someone chime in here in a little bit. But a lot of these are really focused on, as you can see, a lot of housing needs in the Clark County side. So we've got the Community Housing Fund, the Rapid Rehousing Project, Operation Home, which is really focused on our high-risk homeless population in Clark County, non-congregate shelter, which was really focused a lot on the COVID-related needs of the population. Rental assistance and eviction aversion funding was another area. And this last one, it's not necessarily housing, but it's very much focused on the homeless population. It had to do with the Wash and Wellness program, which is really about wellness for our homeless population and making sure they're getting some of their basic needs met, like you know, health and cleanness and other needs. Next slide. And then City of Las Vegas, they had 2 big items that they talked to the group about and presented. The one had a lot of material about this, or they didn't really bring slides, but they talked a lot in detail about this, was the Courtyard Homeless Resource Center, which really is a big initiative they have that really supports the homeless population in the city of Las Vegas. And they also have some needs around their transitional housing units. Next slide. And then we did receive 2 public comments that came through for recommendations from the public. And again, if folks feel like anything was missed, please feel free at the public comment to chime in and let us know, and we can add them to the list. The first one was Project Echo, which I would say in the health plans contracts, which is different than the state law. The profits, one of the initiatives they are asked to fund, or at least look into funding, is Project Echo, because it's really, for those of you who may not be familiar with it, it's really aimed at expanding capacity of our primary care front line providers to do a lot of services that sometimes they may not have the staff to do in terms of like behavioral health support and other needs, substance use, and really supporting primary care providers as our frontline providers. The other one here is population health software. And this came from our primary care association in Nevada, and they were asking for funding to really support some software and data sharing to really better do population health for their centers, their member health centers. And next, I think that's it. Next slide, please. So when we looked at all of these together as a whole, and we looked back at the purpose of the, and this is again consideration for ranking. So definitely wanted to say, this is our attempt to give you a straw man hold on just a second, my children. I'm sorry, they're homesick, so, you know, can't tell, but they're loud. Considerations for ranking, we wanted to give you guys a straw man, to something to work from. And so what we used was the priorities set forth in statute, but also generally across the board, a big focus, you know, especially for number 1, was homelessness. And so we really ranked all the homelessness initiatives and said, you know, as a committee, it seems like this seems to be a big priority coming forward to the group. for consideration as sort of the biggest piece that you would recommend to the MCOs for spending. The second piece really fell around disparities and social determinants of health. And I listed some here, like food supports was another one that seemed to be a big focus and need. Provider access disparities. I think it doesn't matter if you're in urban or rural, there's a challenge there in terms of just capacity, and Project ECHO falls in that bucket. Environmental and wellness, Henderson, population health software, just thinking through if these make sense, if they don't, we can take them off or move them down. And then also education. So, and we put these all together really because when we think of social determinants of health, these are a lot of the buckets that those things fall into, like environment, right? Education and access to care. Next slide, please. And that's it. So we'll go back. LaShawn, do you mind going back one more? Sorry. Okay, so that's how we group them, but open to ideas and members, if I don't know what's next on the agenda, LaShawn, if you want to help us with this, but I think if you guys want to have some discussion, it might be good. And then we can discuss whether or not you guys want to rank them differently or take a vote on it.
Up next on the agenda was to have that discussion. So I'd like to invite any members of the committee if they want to add anything or move anything around to express your thoughts.
So this is Suzanne, maybe not surprisingly, that looks good to me. But I do know that we asked for a couple of members to serve on this committee as non-voting, but and don't want to put anyone on the spot, but was just interested in highlighting that fact and seeing if we have any members participating today who have strong thoughts on this that they want to share with the committee. I would certainly be interested in that perspective before we vote. If we do have anyone here today that would like to share, certainly interested in all of the other members of the committee's thoughts as well, but just wanted to highlight, that it was important to us to try to get some feedback from actual members served by the program as well. So thank you.
Yeah, so this is Frank Deal. I'm one of, if not the Medicaid subscriber reps, I guess. And after listening to that, sorry if I sound a little weird. I had my wisdom teeth pulled out. Glad we got that on record yesterday. But listening to and reading along, I think that covers it. Honestly, the main things I can think of to come across, the closing some of those social determinants of health barriers. Number one has to be housing with homelessness and, food supports. The only other thing I can think of that maybe isn't on the list would be specifically to childcare and babies. I come across in my line of work a lot of single dads, single moms who don't have formula and diapers and things like that and are very much in need of that. So some of those disparities for very infant children could also be a workable solution for the MCOs in social determinants of health. But that's my 2 cents on that.
Tim, would you like to speak? Oh, sorry.
Yeah, I was going to echo Frank in regard to what we have listed here on item 2, bullet 1, food supports. Maybe a lot of jargon we use in the government arena would be basic need supports, which tend to include diaper and formula and those types of things. So maybe a suggestion to augment the verbiage on that particular item to be a little broader in that space. And not to take away from the other members, but just so I'll speak once. I do very much like how these came out. Stacey, in your presentation, all these align with social determinants of health, housing being one of those determinants as well. And housing is healthcare. It has been our rally cry for a decade. And so just really proud to see that sitting at the top of the list for recommendation.
Hi, this is Haley. I'm wondering, I just want to see, and when we're talking about all housing, are we talking about all the supportive services as well for that? the recommendation, like permanent supportive housing activities?
It was everything that was presented on the slides before, but if we wanted to add more things, let's go back to, LaShawn, could you go back a couple slides and we'll walk through it so you can see that. So this next slide, there we go. So the housing piece here was the housing homeless response team. So anything that falls under that. Then the next slide, please, there we go. And all these pieces. I mean, I think some of that maybe does fall within what you're talking about, but if we wanted to add an additional, piece here to our recommendation, we could. Next slide, please. And then this one as well. And I would say some of the courtyard pieces, I think a lot of what they're doing is trying to connect people with permanent housing. But if there's something you want us to add to the recommendations list on the next slide, we can do that as well.
This is Margaret LeBlanc.
First slide, please.
I'm sorry, Haley, what was that?
Would you mind going back to the first slide that you just showed again when we first started talking about this?
Are you speaking about this slide?
Back one. Yeah. When you were just showing.
Oh, this, yeah. Was it this one or was it Henderson City?
The one, move forward one again, please. Another one. Maybe back one, sorry. I'm just trying to relook at this because I'm trying to think about where I'm not seeing it really called out specifically, and I don't know, Tim, if you're seeing it, but around more of the longer term permanent supportive housing services to keep people in their housing, like with some case management. Particularly, we're seeing that with folks who have disabilities, behavioral health issues. They sometimes don't understand what they need to do to maintain their housing. And so we're currently experiencing quite a few folks that are looking at eviction to complete the paperwork because they have mental health issues that they don't understand what they're trying to do or supposed to do. So it's that kind of stuff.
Okay. We can definitely, I think we can definitely list these, initiatives here, but say in the report that the members felt very strongly that any initiatives that really focused on, long-term permanent housing and helping them avoid eviction and stay in their housing, those also would be initiatives that would fall as in top ranking and support from this committee. Does that work, Haley?
Sure, and I can send, or even Sarah may have a good definition of what permanent supportive housing services include, if you guys need additional clarity on those.
Yeah, if you could send that over to LaShawn, our committee administrator, she can help us add that into the report if that works. And if other members obviously are in agreement with that, I think that makes sense.
Tim, did you have something to add?
It.
Yeah, thank you for clarifying. So just a couple of things. One on the county side, so slide 8. Just for the record, if we got a number 5, revised to eviction diversion rather than aversion.
Yeah, I think that might have been a typo. Thanks.
While we do have a strong aversion to
yeah.
But,
yeah, good point.
Certainly would, again, going back to the slide where we talk about basically all housing initiative support being the thing we recommend to the managed care. What I know what the county did was we presented what we were doing, not so much of recommendations for what we thought the managed care should be doing, hoping they would come alongside. So just in that verbiage of, supportive housing, and supporting the housing initiatives of the jurisdictions, inside that, to Haley's point, are the housing search and location services, which I know there's a 1959 waiver out there that's being worked that would be, create some Medicaid funding. But there are those then housing supportive case management that there are some MCOs doing some things already for their members that help keep them housed as well. And by way of treatment and just some general mediation with landlords and things of that nature. So again, attempts to house people and keep them housed. I'm okay with certainly as a recommendation being that kind of broad, and so long as we continue to have this vehicle, this meeting, to make sure that the organizations are then dovetailing in and maximizing the large investments that local jurisdictions have made. So kind of working with, right, in a supportive way.
We can definitely frame that. I just want to say, so that way we're clear, that because I think, we're also seeking, I don't know, and we haven't really talked about this in this group, but we are seeking approval of Medicaid funding and the managed care program as well for those supports that you just talked about. We're doing a very large package to CMS, similar to what California is doing. It's similar to 1959, but I would say it's even broader. So maybe what we put in there is say, in almost not in lieu of, that's what they're called, in lieu of service, but almost like in lieu of that package being approved, right? Like this is what you recommend as sort of a priority. But if that package is approved with Medicaid dollars, maybe, my point is I would hate for us to say that go fund this, but we're actually going to get Medicaid dollars to fund it more broadly. So I would, trying to think through how do you not, I would rather see the profit, I'm just thinking out loud with you guys. If you want to use the profits appropriately, we probably want to spend them on things Medicaid dollars are not, right, available for. So maybe if Medicaid funding is not available for these services, these are priorities. But if Medicaid funding does become available, right, then these other priorities kind of fall into the list. Does that make sense, what I'm trying to say, Timothy?
This is Haley. Sorry, Tim, go ahead. So this is Haley. I would agree with that. I just think it's really important. If those Medicaid services were approved, would the fee-for-service folks receive those same services? And not just the managed care organizations, because we do have lots of folks that are on fee-for-service.
Yeah, so we looked at the data.
That are a little bit more challenging.
Yeah, so we looked at the data on this, and almost 90% are on managed care. But the 10%, we are still trying to find out if it's not 1915I, because there's some issues with that implementation. We don't have the appropriate, I'm trying to remember what they're called, administrative entities that want to do that. I think it needs to be the counties being that single entity. So we don't really have that working right now. So we're trying to find another state plan authority. So we have it on both sides of the delivery system. But right now, we're pursuing both approaches. It's just we're kind of trying to figure out another authority where we can still roll out these services on the fee-for-service side as well.
Are there any other committee members that would like to provide comments for discussion? Not hearing anything, so we'll move on to agenda item number 7, public comment on the rankings. If you would like to provide public comment, please raise your hand or type public comment in the chat and the last 4 digits of your phone number or your name, and you will be called on, I think, by LaShawn.
I am not seeing anybody with their hands up, or I do show. Okay. Yeah, I am not seeing anyone.
Let's just give it one more. Maybe restate that one more time. So I think we had a couple people just come back through. I don't know if they fell off or what, but we had some members come back in.
Yeah, I wanted to give people some time to type if they needed to. So right now we are on agenda item number 7, public comment regarding the ranking of these items. If you would like to provide public comment, please either raise your hand or type public comment in the chat, and your name will be called to begin.
Looks like Sarah.
Sarah?
Yeah.
Yes, thank you. I just want to chime in again, Sarah Adler with NAMI, Nevada, for the record. I just want to chime in again and in support of Haley's comments, the very important need to direct available resources to permanent supportive housing. And I further concur with the thinking aloud that you have been doing to make it possible to say if Medicaid comes through with the ability to fund these services, then MCO profits can turn to these other very important components of the social determinants of health. So thank you very much.
There is no one left in the queue.
Okay, next on the agenda is item number 8, finalize the ranking of these items with consideration for the comments made by the committee members and public.
Chair, could I just make sure I repeat back to you guys what I heard, so that way before you vote on the rankings, we have an understanding. I just want to make sure I didn't miss anything. So it sounds like for number 1, we want to make sure the definition is broad enough to include permanent housing and sustainability of housing. And Haley and others are going to provide a little content by email to LaShawn to define that for the report. And we will also list all the initiatives that were brought forward by Clark County, Las Vegas, and City of Henderson as number 1. And then number 2 would be the disparities in social determinants of health. Tim, I think you mentioned something around maternal health, but it kind of cut out. Do you mind repeating that so I can make sure I have that correctly? Okay, so maybe we can do that. Timothy Birch, did you hear me? I'm sorry. I was just wondering what you said originally around the maternal health. Didn't you say something around diaper? It cut out when you were talking about diapers.
Yeah, sorry.
Yeah, no, it's okay.
Little laggy.
Sure no, it's okay.
Just that food to the earlier speaker's point, to Frank Deal's point around food supports, make sure that perhaps an expansion to basic needs supports, which typically from a food bank standpoint includes diapers and formula and those types of things to make sure that maternal health is considered. So just broadening that.
Okay. So I'll add that to what we also changed. So that will be added into the report. I see Haley has her hand up. Sorry, Haley.
No, that's fine. So yes, permanent supportive housing services. That's the phrase that we want to get in there.
Got it.
And I will send the language.
Okay. Are there any other changes to the recommendations that I might have missed that we're not in agreement? I just want to make sure we all have it before folks vote or finalize the ranking. Okay.
I think we have our last set of public comment on agenda item number 9. Do any members of the public want to comment on the finalization of the ranking? And if you would like to leave public comment, just raise your hand or type public comment in the chat.
I don't see anybody in the queue.
Okay, thank you. We are on our final agenda item number 10, the adjournment. Our next meeting is scheduled for March 2023. And that concludes this meeting.
Do you want me to give folks an idea of when the report's coming so we could do that real quick?
Yes,
Sorry,
please, thank you.
It's okay. I just figure people might want to know. So we will take today's conversation, summarize it for a report, send it out to committee members. We'll also post it on our website for a few days for feedback and just make sure everyone's got a chance to look at it. And then we'll try to finalize it by December 31st. If it's a little later than that, we'll do our best. But we'll try to get everything down on paper and make sure that it's accurate and members are fine with it before we send. I think that's it. Thanks, Margaret.
Thank you, everyone. That concludes our meeting.
Bye. Thank you.
Thanks, everybody.
Bye.
Happy holidays, everybody.